everyone. Today we're going to be talking about different topics of GI problems. Alright, so the first topic we're going to be discussing is appendicitis. Appendicitis is an inflammation of the appendix. The appendix is located and attached to the cecum in the lower right quadrant of your abdomen. Appendicitis commonly occurs when the appendix lumen becomes blocked by hardened fecal matter, also known as fecalate. If the obstruction results in distension and accumulation of bacteria, it can lead to gangrene, perforation, and peritonitis. Now, what clinical symptoms should you look for in a patient with appendicitis? Appendicitis typically begins with dull periumbilical pain, followed by anorexia, nausea, and vomiting. The pain initially appears as a constant, unrelenting discomfort that generally migrates to the right lower quadrant and becomes concentrated at McBurney's point, which is halfway between the umbilicus and the right iliac crest. Other symptoms that might show are low-grade fever, localized tenderness, rigidity, rebound tenderness, and muscle guarding. Coughing, sneezing, and deep inhalation worsens the pain. The patient usually refers to lie still, often with the right leg flexed to alleviate the pain because it prevents the appendix from touching the abdominal muscle. Diagnostic tests include CT scan with contrast, ultrasound, MRI, Chem7, and CBC. For nursing management, the patient needs to be NPO and prep the patient for OR and surgery. The surgical procedure is appendectomy, which is removal of the appendix. Additional nursing management includes IV fluids, narcotics for pain, acetaminophen for fever, Zofran for nausea and vomiting, and antibiotics to prevent and control infection. Alright, so the next topic we're going to be discussing about is peritonitis. Peritonitis is a serious medical condition characterized by inflammation of the peritoneum, which is the thin tissue lining the inner abdominal wall and covering most of the abdominal organs. This inflammatory response can occur either as a localized reaction affecting only specific areas of the peritoneum or as a generalized process involving the entire peritoneal cavity. The inflammation typically develops as a result of bacterial contamination. Now, there are several risk factors for peritonitis, including the presence of blood-borne organisms that can cause infection, underlying liver cirrhosis, which compromise immune function, ruptured appendix releasing bacteria into the peritoneal cavity, blunt abdominal trauma causing internal injuries, complications from peritoneal dialysis procedures, perforated intestine allowing digestive contents to leak, and post-surgical infections following abdominal procedures or surgeries. Now, each of these conditions can introduce pathogens or irritants to the peritoneal cavity, triggering the inflammatory response characteristics of peritonitis. Abdominal pain is the most common symptom of peritonitis. A universal sign is tenderness over the involved area. Rebound tenderness, muscular rigidity, and spasm are often other signs of peritoneal irritation. Patients may lie still and take only shallow breaths because movement worsens the pain. Abdominal distension, fever, tachycardia, tachypnea, nausea and vomiting, and altered bowel habits may be present. Serious complications of peritonitis may include hypovolemic shock, sepsis, abscesses within the abdomen, intestinal paralysis, and respiratory distress syndrome. Without prompt medical intervention, peritonitis can be fatal. To diagnose and rule out peritonitis, we can do imaging tests like CT, X-ray, or ultrasound. We need to check the patient's CBC to rule out infection, especially their white blood cell count. Peritoneal aspiration is a diagnostic and therapeutic procedure where the fluid is removed from the peritoneal cavity using a sterile procedure. For nursing management, the patient will need to be NPO, administer IV fluid, place an ND tube to low intermittent suction, and provide oxygen as needed. Infuse blood transfusion if the patient has low H&H or is actively bleeding, and perform surgery to clean out the peritoneal cavity if it's contaminated. Administer antibiotics for infection, analgesics for pain, and antiemetics for nausea and vomiting. Now, the last topic I want to discuss here is gastritis. Gastritis refers to the stomach lining inflammation and represents a common gastric disorder. It can present as either acute or chronic and may affect the entire stomach or only specific areas. So, gastritis occurs as the result of a breakdown in the normal gastric mucosal barrier. This mucosal barrier normally protects the stomach tissue from the corrosive action of hydrochloric acid and pepsin. When the barrier is broken, hydrochloric acid and pepsin can diffuse back into the mucosa. This back diffusion results in tissue edema, disruption of the capillary walls with loss of plasma in the gastric lumen, and possible hemorrhage. Risk factors are similar with peptic ulcer disease, and this include NSAIDs, aspirin, corticosteroids, alcohol, smoking, H. pylori infection. All of this can weaken the mucosal barrier. The symptoms of acute gastritis include anorexia, nausea and vomiting, epigastric tenderness, and feeling of fullness. Acute gastritis is self-limiting, lasting from a few hours to a few days. Hemorrhage is commonly associated with alcohol abuse. Now, for diagnostic tests, we can recommend endoscopy with biopsy, CBC to check their H&H, and stool tests to look for H. pylori bacteria. Now, for nursing management, your patient is going to be NPO and placed on an NG tube to relieve abdominal discomfort. We can prescribe H2 receptor blockers and proton pump inhibitors to decrease gastric acid secretions. Do note though that chronic use of proton pump inhibitors can result in osteoporosis. IV fluids to maintain normal blood pressure and hydrate the patient, antiemetics to prevent nausea and vomiting, analgesics for pain and blood transfusion if the patient is actively bleeding and has low H&H. And of course, educate your patient to stop smoking and drinking alcohol and to avoid taking NSAIDs and corticosteroids. Alright, that's it. All the topics that we discussed today are going to be part of your exam too.